Many patients ask me, Doctor, when do you say a person to have high blood pressure? On what readings of blood pressure do you say a person to have high blood pressure? Many of the patients, they ask me in my office or whenever they get me anywhere, any place, they ask me. Hello, welcome to Dr. Akinclicks, and I am Dr. Akin. Today I am going to share with you and basically inform you when does a doctor brand or designates a person to have hypertension. So first of all, let's know on what values a doctor says a person to have hypertension. According to Joint National Committee, that is a committee of USA, the 7th National Committee, Joint National Committee says that if your blood pressure readings are 140 by 90 millimeter mercury and above, that is if you have 140 millimeter mercury readings in the numerator, which we say systolic blood pressure, and in the denominator 90 millimeter mercury and above, then we say you are a hypertensive person or your blood pressure is in the hypertensive range. So remember, a blood pressure reading 140 by 90 millimeter mercury, that is 140 in the numerator, that is called systolic blood pressure, and in the denominator 90 millimeter mercury and above, that is the diastolic blood pressure. If your blood pressure is 140 by 90 millimeter mercury and above, then we say that your blood pressure is in the hypertensive category. Remember that according to the Joint National Committee on Hypertension, that is the 7th Joint National Committee of Hypertension, the blood pressure can be divided into 3 types. You will have either a normal blood pressure, you will have a pre-hypertensive blood pressure, and then you will have hypertension blood pressure, or your blood pressure is in the hypertensive range. We say if your blood pressure is up to 120 by 80 millimeter mercury, then you are having normal blood pressure. If your blood pressure is more than 120 by 80 millimeter mercury up to 139 by 89 millimeter mercury, then you are in the pre-hypertensive range. And if your blood pressure readings are 140 by 90 millimeter mercury and above, then you are having high blood pressure. Actually, hypertension is divided into 2 types, that is, if your blood pressure is 140 by 90 millimeter mercury up to 159 by 99 millimeter mercury, then this type of hypertension is called stage 1 hypertension. And if your blood pressure is 160 by 100 millimeter mercury and above, then it is said to be in the stage 2 of hypertension. Leave aside all these different categories or stages of hypertension. Please remember that if your blood pressure recordings are 140 by 90 millimeter mercury on multiple occasions, then you have hypertension or you are a hypertensive patient. Please do not go into these categories of stages or categories of hypertension. Just remember that if your blood pressure recording is 140 by 90 millimeter or more, then you are a hypertensive person. So now there are 2 types of people, those who present to the doctor related to hypertension. The first type of person are those who have already the recordings of blood pressures on different occasions. On more than 3 occasions, they themselves have got the blood pressures recorded in a hospital, in a clinic, or with the healthcare worker, and they bring to you to show whether they have high blood pressure. If on more than 3 occasions, on different occasions, if the blood pressure recordings are on an average more than or equal to or more than 140 by 90 millimeter mercury, then it is confirmed that this person has high blood pressure, which is in the hypertensive category. Then we can say that you are a person who is in the hypertensive category, and we can, as a doctor, we can advise him or her to be on medications. Then the second type of persons are those who present to you or those who present to the doctor for the first time with high blood pressure. That is, they present to the hospital or clinic for the first time with blood pressure recordings 140 by 90 millimeter or more. For the first time in their life, they present to the clinic with these readings of high blood pressure, and on further inquiry, on further interrogation, on further asking, they will tell that, doctor, I have previously also measured my blood pressure, but they were never such high. So that means this person is presenting you for the first time with high blood pressure. Then you need, as a doctor, you need to ask whether they had slept well, whether they are having fever, whether they are irritated, whether they are anxious, whether they are restless. There can be episodic elevation of blood pressure, or there can be episodic recordings of blood pressure in the hypertensive category. If you are not well, if you are having fever, if you are having inflammation in any part of body, if you have not slept well for many days, if you are anxious, if you are irritated, if you are angry, or if you have just come running to the clinic without waiting at the doctor's office resting area for at least 5 minutes, then your blood pressure can be elevated, or you can have blood pressure readings in the hypertensive category. So whatever may be the cause, whatever may be the situation, if a patient presents to the doctor's office with blood pressure readings in the hypertensive range, in the hypertensive category, whether it is episodic or whether it is for the first time, or whether for multiple occasions the patient presents with hypertensive category blood pressure readings, then the doctor will start on antihypertensive medications. If a person who has had many recordings of high blood pressure in the hypertensive category, to that person the doctor will surely start on antihypertensive medication and call him back for follow-up. But if a person for the first time has presented with high blood pressure readings in the hypertensive range, to such person the doctor will start on antihypertensive medications for few days, say 5 days or for a week, and then ask him or her to record the blood pressure for 3 days or more on different days, and bring the blood pressure recordings to the doctor for analysis. And if the doctor later finds that the blood pressure readings or the recordings are on an average 140 by 90 millimeter mercury or more, then the doctor will ask the patient to continue the blood pressure medication or antihypertensive medications, because now it is confirmed that it was not an episode of hypertensive readings, but this person is having high blood pressure recordings on more than 3 occasions. Then the doctor will start on medications, and in the meantime the doctor will go into the clinical details, clinical history, clinical examinations, and advise you for various tests to rule out whether there is a cause for this high blood pressure or a cause for this hypertension. Remember that around 90 to 95% of persons having blood pressure in the hypertensive category do not show any causes. To them we say that they have essential hypertension or primary hypertension, and only in around 5 to 10% of people there is a cause for hypertension. The cause can be because of vascular abnormalities, because of kidney diseases, or because of hormonal problems. When there is a cause or when there is a reason for hypertension which can be corrected, which can be treated, and when such causes are found and the person is having blood pressure in the hypertensive range, then we say that that blood pressure or that hypertension is a secondary hypertension. So please remember that the doctor will not easily brand you to have high blood pressure, or doctor will not easily brand you or designate you to be a hypertensive person, or doctor will not designate you to be a person who is in the hypertension category. Before that, doctor will evaluate or monitor your blood pressure, and if your blood pressure readings are on multiple occasions, basically more than 3 occasions, if your readings are more than or equal to 140 by 90 millimeter mercury, then only the doctors will tag you to be a hypertensive person, or tag you or designate you to be a person who is a hypertensive person, or who is having blood pressure in the hypertension category. Therefore, please remember this, and this is very important to know for you to follow up with the doctor. So if you like this video, please give a like, and if you are watching this video for the first time, please subscribe and press the bell icon so that you will get latest regular updates on health and health related issues whenever I upload a new video in this channel. Thank you.